morning, good afternoon, good evening. How are you doing? It's Teshua Jogona here. And guys, how have you been? I hope you've been well. Every time I'm here, I always feel fulfilled, blessed. Yeah. And every content I make, I always feel like it has a purpose. So guys, if you're an existing member, thank you so much for sticking around. If you are a new member, feel welcomed. And if you are a returnee, welcome back home. So guys, I know, I know you might be asking yourself if you've been following me, because we talk mostly about this visa's eligibility and cost of living in the UK, how is life, lifestyle and so on and so forth. So if you've been following me about health and care workers visa, you will realize that this visa it was confirmed by the government of UK on the 15th of February 2022. Care workers and home carers will be recognized on the skilled workers shortage occupation list. So that's when it was confirmed, on the 15th of February, and it's supposed to be reviewed 12 months later, which is 15th of February 2023. Yeah. And I know you might be asking yourself so many questions, like, will the visa still be on shortage occupation list? Will this visa still go on? Because remember, this visa has been very like an opening door to people that want to relocate to the UK or come and work in the UK. A lot of people have moved to the UK through health and care workers visa, as nurses, as healthcare assistants, doctors, name them, all those people. So it is a very good route, or very good visa, So I'm sure if you've been following, at some point you're asking, so what will happen after February? And I'm here thinking, you know what? In my opinion, probably nothing will happen, because the review is to see if the visa, this provision has worked. Yeah, has it worked? Do they need time? That's why there's need for review. And looking at it, yes, a lot of people have come, but yet with a lot of people coming in, a lot of people are leaving the healthcare system. Nurses in the UK are leaving NHS. They're leaving care homes. Like, people are leaving and actually the percentage, I don't know, I'm not sure if I'm able to see to check, but if you are aware, let me check. I'm just typing on my computer. So there is let's see here. Let's see. It's like it is associated with burnout. Yeah. So a lot of nurses are actually leaving their work. And mostly, I would say, if you're an overseas nurse and then you come, of course, you will work, because that is the visa that has brought you, However, people that were born here, they've done their nursing here and so on and so forth, then you will find, most of them are leaving the job. And that's because basically life, the cost of living here has gone really high. And of course, if you do a degree in the UK, your degree in the UK, then and you're an UK citizen, you end up coming out or finishing your degree with at least you owe the government at least £60,000. Yeah. And remember, when you start working, they start deducting their money if you've met that threshold, like, the amount they say that if we are earning this much, then we are going to we'll start deducting our money. So with that, and the starting fee is 27,000, not starting fee, but starting salary or wage for nurses as a staff nurse straight from university. It is £27,000 per annum. That is like give or take £1,400. Just if you are a parent and probably you're living in a three bedroom, 4 bedroom house, you are paying at the moment 300, 400, up to over £400 for just gas and electricity. So you can imagine about the other expenses like rent and so on and so forth. Remember, nursing is a career that it takes your life. What do I mean by that? The shifts are long. Yeah, shifts can go up to 14 hours, 14 and a half hours. Yeah, and you're working probably 3 long days. After 3 long days, you actually need another 2 days or equivalent of that to actually recover. Yeah, so a lot of people are leaving the job. As much as overseas nurses are coming in, more people are leaving out, and you find it's basically because of how much they're paid. Because I'm thinking, why should I get paid, I think, £14 an hour, 14 pounds an hour or so, where as a nurse, and I bear all the responsibilities, whereas I can work somewhere, probably in the gas station or in a supermarket. I can even work as a healthcare assistant and get paid even £15, £16 with agency, and with no actual responsibility like a nurse have. So people are like, you know what, let me go. So with that, that means people are coming in, others are coming out. So for me, I feel this is something that will continue and will go on for some time until this situation is solved, and until the government comes with a way to retain the nurses, the healthcare assistants. Yeah, and I would say I would say the most important things, actually, it's not about recruiting. The most important thing is not about getting thousands and thousands of nurses overseas. The most important thing is actually retaining the people that you already have, the people that you've recruited overseas. And that is where the problem is coming, because yes, people are being recruited, but they're not being there are no measures put to retain them. And if you have been following the UK news, you will learn that the nurses are planning a strike, and such a strike has not happened for years and years and years and years. So this strike, the nurses had to vote, yeah, and to strike or not to strike, but the striking won. So there is striking that is being planned, yeah, but it is a planned strike, because remember, at the end of the day, patients have to be taken care of. So there are places like the emergency department, they will not be striking and so on. So anyway, my point is, the point I'm driving home is, it is actually the journey is not coming to an end yet. It's not. And remember, as I say this, it's not legal advice. It's not. I'm not an immigration lawyer. I do not own any company. I'm just. This is through. If you read UK newspaper, if you're on the ground, it's through experience, being on the ground, working as a healthcare assistant, being on placement as a student nurse. Then I get to see all this and actually experience them, and so I get to know, actually, I kind of know what I'm talking about. So for me, I would say, if your dream has always been to come here as a nurse, as a healthcare assistant, continue doing what you're supposed to do. That is, if it's your ELTS, if it's your CBT, if it's your, continue doing them, because at the end of the day, I can't see this journey coming to an end soon. However, as every new government comes in, they try so hard to limit the number of people that are coming in from overseas. So that is another factor that you need to consider, that things can change anytime soon. So you need to hurry up and do what you're supposed to be doing, because things keep changing. However, about healthcare and health and care workers visa, I don't think there'll be much of a change with that kind of visa, because of what is going on. There's still shortage, there's burnout, people are leaving and going to other careers, and so on and so forth. So guys, hopefully that has given you a little insight of what might happen about the review later or earlier next year, after the 12 months. And anyway, we are here to see if anything changes. I'll be here to update you. Until next time, it's Teshwa Jogona, and please stay safe, be blessed, and be kind.